Hi, comrades. Thank you for inviting me to come along to the meeting today in Parliament. I'm really sorry that I can't be there in person. I am Steve North, pronouns he, him. I am the President of Unison. I'm speaking to you today in a personal capacity, but I want you to know that many of the principles and demands that your campaign is putting forward are shared by us in Unison. So a little bit about me, first of all, for those who don't know me. As well as being the President of Unison, I am also the Secretary of the Salford City Local Government Branch of Unison and the Joint Deputy Convener of Unison North West, which is the largest region of Unison. Prior to becoming a full-time branch secretary, I worked for many years in social care. I was a community care worker working in a community mental health team, and I had direct first-hand experience of the distinction, shall we say, between a social care model of support and a more medical model of care. And so a lot of what I'm going to talk about today are based on my own experiences as a social care worker and as a trade unionist who believes in organising care workers, but also standing alongside people in receipt of care and support to ensure that their voice is at the heart, that your voice is at the heart of the decisions that are taken around the care and support that you receive. So when I was elected into the role of branch secretary, I was really keen to ensure that as a union branch, we took seriously the concerns of our members who by that time were working largely within the private sector as a result of privatisation within social care. And because what we found was a perilous state where the terms and conditions of people working in the private sector were bargain basement, were incredibly poor and led to a huge amount of exploitation. So we were really keen to ensure that we rebuilt our union's presence within private social care. And I'm really proud that we did that. And that meant that as we came into the pandemic and the impact that had on care workers, we were able, with care workers, to negotiate a package of support called the Salford offer, which meant that any care worker in Salford who had to take time off work as a result of COVID-19, whether they were ill, whether they were shielding, whether they had a family member who was shielding, that they didn't lose any money as a result. And we negotiated that with the local authority in Salford. We negotiated that with the NHS. And shamefully, there were private providers in the city who, even though they weren't paying for it, still refused to implement it because their view was that if they put it in place in Salford, they might have to put it in place in other places where the public purse wouldn't pick up the cost. And that laid bare and exposed the disgrace that is profit-driven social care. So we challenged that as workers. We delivered the Salford offer in Salford, but we went further. We delivered the foundation living wage in the first instance right across the board, and we're now pushing for further than that. We have a strike taking place in Salford at the moment in 2 care homes against a company called Park Homes who treat their workers appallingly, and we're determined to secure far more than the foundation living wage. We want proper terms and conditions for those workers, and ultimately we want services such as those to be delivered through the public sector. But what we don't want is top-down public sector delivery. What we don't want is to repeat many of the mistakes that have been made through the delivery of an NHS medical model of social care, because the NHS is wonderful. I'm sure everyone I'm speaking to now firmly believes in the principles of healthcare free at the point of need, paid for by progressive taxation, and if only we could put that in place in social care, things would be much better. But we can't stop there, because what we don't want is a hierarchical model where the people in receipt of care and support and the people who are working to deliver it don't feel as though they have a voice. We need a democratic model of public delivery. We need to ensure that the voice of people in receipt of care and support is front and centre. One of the first battles I ever got involved in as a steward in a community mental health team was to protect the rights of the people that we were supporting. We used the term service users. I know that's not always a popular term, but that was the term that we used at the time. And we worked with those service users and the groups that they organised to defend the care and support that they received, making sure that their voice was front and centre. And that led me to believe that together we are powerful, but also it is the right thing to do. So as a trade unionist, I firmly believe in that. Unison is committed to a national care service. We call upon the government to deliver one, but also our policies make clear that we need a strong voice for those people who work in care and support, who are in receipt of care and support, and for their families and for wider communities. We need genuine, democratic public delivery, but we need to get rid of the profit motive. We've all got a job to do in challenging that. I hope that the politicians who are hearing these messages are taking that seriously, because I think we do have an opportunity to build a better future for everybody who has contact with social care and support. So all the best from me, solidarity, good luck with the rest of the meeting, good luck with the campaign, and take care, and I will see you soon, no doubt. Thanks very much. Bye-bye.